And welcome to another edition of the EasyConnectMD.com video podcast minute. Gabe Farias and Dr. Daniel H. Kellum Jr., CEO of Kellum Physician Partners. Dr. Kellum, it's been a little bit. We're back. You look rather dapper.
Someone told me I had to upgrade the look of this side of the table.
Oh, my goodness. Was that a Mrs. Kellum, by the way? It's like Gabe is catching you not only in his hair loss, but in how he dresses nicer than you. Was that kind of the conversation?
They said maybe not. So.
It didn't quite go that direction. Dr. Kellum, Health and Wellness Podcast. We're sponsored by EasyConnectMD.com.
Yes.
A great way for folks to get access to healthcare. Visit EasyConnectMD.com. Enter the coupon code GetWell. You're going to get $10 off of your visit to see a provider. That means it's only going to be $29.95. Dr. Kellum, when is somebody going to be able to see a provider, get a script called in, and take care of what's bothering them, especially now when health and wellness is on the mind of everybody for $29.95? It's crazy.
Rarely, Gabe. I mean, honestly, it's only when you do log into EasyConnectMD.com that you get such a good value. I mean, it's one of the things that, as our organization, we want to make sure that we're providing good care for people at an affordable cost, at a convenient time, and really kind of settle some of the worries that are out there this day and age with one's health.
And it really goes along with the premise of excellence rooted in community medicine. This is not meant for just Schertz, Cibolo, Selma, Tri-County residents. This is meant for people in the South Side, West Side, East Side of not only San Antonio, but Texas. Anybody in the state of Texas can use EasyConnectMD.com.
This is meant for anybody who has a worry with healthcare, no matter where they're at. All across the state of Texas, they could log on to EasyConnectMD.com and get excellent care in front of excellent certified providers, whether it be nurse practitioners or doctors, and get excellent care for the thing that bothers them. What we don't want for people to do is to worry about something that's bothering them and worry about their finances at the same time. And I don't think that one has to be compromised in a situation like that. And that's what we do at EasyConnectMD.com.
And in that, a lot of uses for telemedicine, especially like EasyConnectMD.com, is for information. They may not feel bad, but they may think they were exposed to something or someone as it pertains to COVID-19. And getting that type of expert information from one of our providers, case in point right now, the Delta variant. Everybody right now in this country, when they hear the word Delta, they don't think about a crappy airline based out of Atlanta, Georgia. My apologies to the Delta Corporation. But, Delta right now is a word. It's a trigger word. And people are like, oh, my God, the Delta variant. Talk a little bit about what you know about the Delta variant.
Well, the Delta variant is...
as it pertains to COVID-19, of course.
Absolutely. The Delta variant in this COVID-19 mutation is the one that's predominating, or at least emerging in the United States as a potential threat. And what we noticed initially was the Alpha strain that came from the UK, and that was the thing that predominated us within this first year of the COVID-19 pandemic. This Delta variant has emerged, and it seems to be problematic in the sense that it's a little bit more contagious, for sure. The good news about things, thank goodness, and it speaks again to the wonderful efficacy of these vaccines, is that the people that are vaccinated are covered. Where we worry about are those individuals that are not covered, because that seems to be a little bit of a tinderbox where this can spread quite rapidly, and it has a potentiation to cause more serious conditions for individuals. And so this is one more reason I think that people should reconsider, if they have not gotten a vaccine, to get this vaccine, because you don't want to have an issue with this long term.
And it seems like there's so very few, and of course it is, as you always say, it's your personal choice to get it if you want or not. Your recommendation is, if you're healthy enough and you can take it, you need to get it. What we're seeing now is that all of the vaccines are holding up to the Delta variant pretty solidly, including but not limited to the Johnson & Johnson vaccine. I read a story here a day or so ago that was published on a study that's showing the J&J vaccine is also holding up to the Delta variant as well.
Absolutely. And again, it speaks to the phenomenal job that has been done by research and science to really save our world when it comes to this pandemic. And it is holding true. It's taking care of these particular strains, at least up to this point, that have emerged, and it's doing it in an exceptionally efficacious way. Protecting people from severe disease and death is really what we want to do with that. It's just, again, about getting people who are a little bit on the fence with this, or have not been vaccinated for whatever reason, to re-educate them about this particular harm or danger, and hopefully they can change their mind with that. And if not, again, this is one's personal choice, and we respect that immensely. However, more information is always important when you're making a life-changing decision in some cases.
And I love that you say, when people ask you, why should I get it? You give them kind of your take, but you also say, look up the science, look up what's out there, do your due diligence. This is an important part of helping this nation. I was just down in South Padre, and it was great going around as opposed to a year ago when I went down to the coast, and we were afraid to get even near anybody there by the beach because we didn't know. Now we know. Now my wife and myself are fully vaccinated, and we're confident that others are vaccinated as well. This science has worked, but encourage folks to do their due diligence.
No, I absolutely agree with that. And, initially when these vaccines, so think of where we were, July 4th, weekend of last year. It was a mess. It was a mess. And it was the beginning of a really difficult time here in our community in terms of a spike in COVID-19. And what we worried about then, and rightly so, and what the emergence of this vaccine via Operation Warp Speed was really to help people or prevent people from dying, because it was happening. We didn't know what we were doing. Those poor doctors and nurses in the hospitals were working their fingers to the bone to try to save people, and the emotional toll and the physical toll it took on them was devastating, quite frankly. But what we're seeing now, a year and a half into this deal, is that death is not, it's a small percentage of people that get that, and I think we can all agree on that. But the bigger issue that we're learning over time is just the long-term consequences of COVID, where people continually feel bad from a heart issue or a respiratory issue or a mental issue or a chronic fatigue issue. And that is the thing that really bothers me personally the most, and that's why I would encourage people to look at that, because there's no doubt that the chance of survival of this is really high, but about 30% of the people that we're seeing, and that's anecdotally in our practice, are continuing to have long-term issues once they have COVID, and we don't want that for people. And so initially it was the mortality, but now it really is the morbidity, how people live with this long term. And I think that's a really important thing for people to understand. And as doctors, and in this new situation, we're learning now what are the long-term effects, whether it's heart issues, arrhythmia issues, breathing issues.
Something,
So it is definitely something. And we're tailoring the way that we look and prevent and practice and treat because of those particular issues. And so, that's where I think these considerations should be made. On top of that, now you have these Delta variants that are coming that can be a little bit more problematic for people. I mean, I think really the evidence is showing that the need is great. Again, people, I would hope, can just look at that, reflect on this, listen to us, ask somebody, and get a solid, unbiased opinion about the science. And in that, people can make their decisions based on their personal situations and beliefs.
Yeah, because it seems like about 98 to 99% of your patients believe you and will go on your word, but you still have those few folks, and that's what you're saying to those few folks. Just do some research. Listen to me, that's great, but do your research. Now, do me a favor. Talk about why the Delta variant and how and why everyone is so frightened about this particular variant of the disease.
Well, because it is highly contagious, it appears. And also, too, it has a propensity to create more serious illness when people get that particular thing. And so, and again, it's in the unvaccinated subset of individuals in the United States where this is really a problem. Again, with the science and data that's coming out, we see that the vaccines are helpful. So for all of us that are vaccinated, we're not having to worry about this. But for those that are, it can be a real issue. And talking about the things that we just all went through, those are the things that we don't want people to deal with. And so if you have something that spreads more rapidly, causes more serious disease, even if there's not mortality associated with that, one could only speculate that the long-term issues with that are going to be high. And that's not what we want people to have to deal with. And so it's just fresh perspective that I think people need to reconsider this whole situation with. And as we continue to emerge in information, we try to give people that additional information so the perspective changes a little bit in their consideration. And hopefully their conclusion will be a little bit different and more pro-vaccine. Not pro, because I don't think people that don't necessarily want the vaccine are either anti-vaxxers or not. I think they just have reticence in terms of whether or not it's applicable to their lives. And with these new perspectives, my hope is that they reconsider that and find that to be the case.
Talk a little bit about the research that is showing, because recently the CDC said, yes, now kids 12 to 17 can
Yeah.
get the vaccine if it's the Pfizer vaccine.
Right.
What are your thoughts and or hesitations, if you have any, on kids between the ages of 12 and 17 getting the vaccine right now?
It's a little bit of a tough space, I will tell you, because you know, with all the work that we've done in getting vaccines out to the community, we are strong believers in people getting vaccinated. When it comes to kids 12 to 18, what we know in that situation is that kids do well, again, in terms of mortality, although there is that issue with long-term side effects from getting COVID that we always worry about. The problem with the vaccine, not the problem, but the thing that came up with the vaccine, both with the Pfizer and the Moderna, is this issue with inflammation, both inflammation of the heart called myocarditis and inflammation of the sac that the heart sits in called pericarditis. And in that inflammation, it can affect individuals in terms of how their heart functions, chest pain, shortness of breath, that sort of stuff. There was about 1,000 people that have had that up to this point. 79% of those individuals recover back to normal. But when you talk about a subset of individuals that have relatively low risk of death and very mild symptom courses, the question is whether or not that risk is worth the vaccine. The CDC at this point has determined that is the case, and especially in these Delta variants, what they worry about is more transmissibility within the childhood population. And so, you know, I think this is something that's certainly going to get more legs as time goes by. We need more information with that. But this is really where I think people have to make decisions based on their families' personal situations. But that age group is not without risk, for sure. And it seems to be a little bit more risk than the older population, the 18 and above population that we've already been vaccinating. But I still think there's probably a reason to do it. I just think that there needs to be a little bit more information out there for all of us to chew on and make a little bit better decision.
Okay. And of course, talking with somebody, you know, like for us, you know, come into our clinic, get the vaccine. It's not going to cost you anything. 210-945-2121. Give us a call and come in and get it, whether you're a patient or whether you're not. Dr. Killam, we have vaccinated literally thousands and thousands of people that are not our patients in all walks of the state of Texas, because we're not trying to recruit you away from your family doctor. We're not we're just trying to do the right thing and protect our community. And that's basically rooted in what we're doing.
No, for sure. And we've talked about this before, Gabe. There's no competitors in a situation like this. We are one profession that's really meant to really protect our communities. And if we don't stand hand in hand in trying to make people better, then we're not doing the right thing. This is not about one side or another.
No, it's not.
This is about our people and our community and the place that we live and the place that we love. And that's why we're so dedicated and committed to this. We are both products of San Antonio in this area. And our businesses thrives in this Tri-County area. And, you know, we owe this to the people that we take care of, that deserve to have people advocating for them. And that's why we do this. And this is not about being us versus other doctors. We are all in this together. And I think when people have that approach and they move forward with this, that's where we make some strides in making this better, as we have done within this community.
Great point. I absolutely hate everything and everybody that went to Central Catholic, but I love you for what you're doing, right? It's like this is a team. You didn't go to a real high school like McCullum, like I did.
And God bless the people from McCullum. I just don't know how they passed you through.
You have no idea. I've got more Central friends than I've got any other high school, maybe combined.
I need to talk to them about why they
the other
would be
two. I've got
friends
3 friends, and it's you and 2 others. Your brother. I don't know if your brother counts me as your friend.
Or
maybe. And Ruben Cortez from Pico de Gallo. Y'all are my 3 friends. Yeah. I don't even think Roland Gutierrez calls me a friend. That's crazy.
Because he's a smart, educated man.
Dr. Killam, this video podcast, thank you for all the information. I got to tell you, thank you for being that leader out in the forefront, taking the chance, taking the risk, going to areas that you have no clinic and no presence in, only doing it because it's the right thing. So on behalf of me and my family and the rest of Texas, thank you. You had some nice words from Councilwoman Villagrán a few weeks ago, who, when I said Dr. Killam, her face lit up and literally went into thanking you for the vaccines that you provided in the South Side. She's like, you don't even have a clinic there. I'm like, nope, we just did it because it's the right thing to do.
It's the right thing to do.
Yeah. And if you guys do want to talk to a medical provider for any issue like this or any acute health and wellness issue, easyconnectmd.com. Enter the coupon code GETWELL. You're going to get $10 off your visit. Dr. Killam, $29.95 to see a provider, get a script called in. Unheard of in these times. But you're doing it because you're trying to help our community.
Absolutely. And one little thing to that, if I may, when people are worried this day and age, the first thing that they do is they search. They search a symptom issue, and they get a million things that make them more worried than they need to be.
Yeah.
What I would say with that, for $29.95 to settle that issue and not worry about it all the time, get on Easy Connect MD.
Talk to somebody.
Talk to our
That's it,
provider.
yeah.
They will give you the perspective that you need when you're looking at all that stuff, so that you can make sure that you're making good choices about where your healthcare can be. We can handle any and all urgent care things that are brought to us in Easy Connect MD, but more importantly, what we can do is provide assurance, affirmation, and direction for people. If something is a legitimate issue, our providers are well trained, and they can make sure that you get in front of the people that you need to get to make sure that it's better, as opposed to just sitting in a sea of searches and worrying about stuff and not really understanding a perspective to how you need to put that together. Yeah. And so we're more than happy to be that conduit for individuals as well.
EasyConnectMD.com. Enter the coupon code GetWell, $10 off your visit, only $29.95. Dr. Kellum, thank you so very much.
Okay,
you look rather dapper. Again, I need to mention that one more time.
Can you step up your game next time?
I know. I bought this shirt at Solo Serve. Where did you get your stuff at? That's Puro Men's Warehouse. That's Puro Men's Warehouse right there, amigo. Anyways, all right. For Dr. Danny Kellum, I'm Gabe Farias. Folks, stay healthy.
This past weekend, I was struggling, not feeling so good. I had a lot of nasal and chest congestion. I really didn't want to go to an urgent care clinic because I don't want to be in a crowded waiting room. I heard about telemedicine, and someone recommended EasyConnectMD.com, and it was so effortless. After a few easy steps, I was on with the doctor. All I had to do was enter some basic information, list my symptoms, then I gave them my preferred pharmacy, and before I knew it, I was talking to a provider. Within an hour, I was on my way to the pharmacy picking up my prescriptions. EasyConnectMD.com was so simple to use, and after this experience, I don't think I'll ever visit another urgent care clinic again.